nasal plugs. These are available in three sizes: the large size, the medium size, and the small size, depending upon to the age group of the patient. The nasal plug should be snugly fitting into the nasal cavity and should not cause any alar distortion. This is the tube, also known as the pressure sensing tube. The one end of the tube is attached to the nasal plug, and the other part of the tube goes into the inside the mask for the pressure sensing. This is the mask which is used for the used to measure the nasal resistance. The mask is also available in different sizes according to the age group of the patient. The mask should be snugly fitting upon to the patient's face, and there should be no air leak. Next is the machine of the rhinomanometry. The machine available in our department is the Rhinotest 1000, and this is attached to the software on the console, also known as the Rhinotest. Now we begin with the procedure. First of all, we have to make the patient sit into the chair comfortably. The patient should be calm, composed, explain about the procedure, and the patient should be quietly breathing. So here we begin with the procedure. हम आपका एक जांच करेंगे, एक मास्क लगाएंगे आपके चेहरे पे, और उसमें एक ट्यूब होगी कि आपके पहले एक तरफ राइट साइड के नोज में डालेंगे और फिर लेफ्ट साइड के नोज में डालेंगे, या आपके हम साइज के अकॉर्डिंग भी डालेंगे. अगर आपको कोई भी दिक्कत होगी तो आपको बताना है. आपको बिल्कुल नॉर्मल सांस लेनी है, जबरदस्ती गहरी सांसें नहीं लेनी. After explaining to the patient, I would like to describe about the software of the machine. This is the Rhinotest software. Here we click on the file and we select a new patient. Here we enter the details of the patient, which includes the name of the patient identity code, date of birth, weight, height, sex, and then we click OK. Here after entering, we click onto the anterior, as we are going for the anterior rhinomanometry first. After clicking onto the anterior rhinomanometry, there appears a green button onto the panel. We have to click it. For this, the machine has to be calibrated before starting. For calibration, we click on the green button. And then we have to place our palm onto the mask. It should be tightly fitting and there should be no air leak. The machine will calibrate itself to
mask
zero.
Is larger than the size of your arm. In that case, you can place against the flat surface.
Now, we can see a pop-up box which shows the airflow from the left nasal cavity, and the right nasal cavity is to be occluded. So here we proceed with the examination. We select the appropriate size nasal plug for the patient and we attach it onto the one end of the nasal tube. And the other end of the pressure sensing tube is attached to the nozzle provided inside the mask. Then standing in front of the patient, we place the mask over the patient and we ask the patient to insert the nasal plug into the nasal cavity of the patient. It should be comfortably and quietly inserted, and there should be no alar distortion. And the patient, then please take off your specs. And we place the mask over the patient. The mask should have no air leak. The mask should be tightly fitting all around the face. There should be no air leak. And also we have to take care that the tube, the pressure sensing tube, it should not be kinked anywhere. Now after making sure that the mask is completely sealed around the cavity, we ask the patient to hold the mask and we press OK. And we ask the patient to take normal breaths. And once the patient starts breathing quietly, the machine starts recording the graph.
Now we can see this is the left inspiration, left expiration.
The machine itself picks up the best nasal cycles of the patient. It depends on patient to patient. Usually, the machine picks up around 9 to 15 cycles for each patient, and it selects the best nasal cycles. The graph which is showing over here, it is of the right nasal cavity. The graph should ideally be falling if the nasal resistance of the patient is good. The graph should ideally be falling between these two lines. The graph that we use for clinical measurement is the flow versus pressure graph. The flow is made on the y-axis and the pressure is measured on the x-axis.
150 is a normal on both sides, negative. So this is on either so not negative positive. This is for
Here there is a
nose and
machine
this is for us.
where there is a two more graphs that are being shown, that are flow versus time graph and the pressure versus time graph. These graphs are basically for the research purposes. Now once the machine will itself pick up the graph and we have to wait for the machine.
The machine will say
The
this
machine
is
also
adequate.
prompts, in case the patient is not breathing quietly, the machine will prompt us to make sure that the patient is breathing quietly. So again we have to ask the patient to breathe normally and calmly. आपको बिल्कुल normal सांस लेनी है. Once again the patient starts, machine starts. Now once you are done onto the left side, right side, now we repeat the same procedure onto the right side of the patient. Similarly, the left nasal cavity is occluded using the nasal probe and the mask is made to fit onto the patient's face in a sealed manner, and then the recordings are obtained. Here we have obtained after the recordings are made for both the sides. The software gives us a graph of this kind. Here it shows the blue line depicts the graph of the left nasal cavity, and the right pink line shows the graph of the right nasal cavity.
So color coding is different for different types of
Now
patients.
we go back.
So we have this one. So there's a sometimes green, red, and
Now once we are
depending on
done
the
with the
nasal
recording
option.
of the anterior rhinomanometry, we proceed on to the posterior rhinomanometry. For this, we ask the patient to put the tube inside the mouth and similarly place the mask over the face. And we cover the mask with the face in a sealed airtight manner, and then
The tube should be on the
patient is
dorsum
asked
of
to
tongue,
breathe
not on the
normally
side of it.
with the tube, but making sure that the patient exhales through the nose. This is the graph for the posterior rhinomanometry. The computer again picks up the best cycles and records the graph according to it.
So then the machine will create once you
Once the
complete
graph
process.
recording is over, we have to click on this button. The computer still takes 3-4 more cycles after the test is stopped. Once it is over, then we can get the final graph of the patient. This is the final graph of the posterior rhinomanometry obtained for the patient. At the end, this is the summed up graph of both the posterior nasal resistance. At the end, we can collaborate the final reading of both the anterior and the posterior rhinomanometry and take out the printout of the graph. The table on the extreme right corner gives us the reading of the nasal resistance that can be depicted in the values of X and the standard deviation. At the end of the procedure, we should make sure that the mask, the nasal probes and the plugs should be all sanitized before proceeding on to the next patient. Thank you.